Welcome to Focus on FCT, a program that keeps you abreast with happenings in the nation's capital. I am Mariam George Jitbo.
Residents of the Federal Capital Territory are hereby alerted to the activities of scavengers, also known as Babambula, which security agencies have identified as a high-level security threat to not only the residents but also to our infrastructure as they perpetrate petty stealing and acts of vandalism on public utilities. More so, they are drug peddlers, serve as spies to terrorist elements, and are ready-made tools for the public disturbances during which they attack people with dangerous weapons. The Federal Capital Territory Administration therefore reiterates that the ban on scavengers aka Bababula operating within the Federal Capital City is still in force. These miscreants are advised to stay off the streets of the Federal Capital City for their own good, as defaulters will be apprehended and prosecuted, including parents of underage children involved in these practices. Relevant agencies are carrying out enforcement of this ban as stipulated. Be law-abiding always. Let's together build the FCT of our dreams. Management Announcer.
I want to appeal to the general public. Numbers will be published. When there's an accident, please call these numbers. The way we move patients, the way we drop them, even though we are trying to give help, patient transport is essential to patient survival. If you just carry them hand and leg and put in the next car, the accidents may not have killed the patient, but the way you manage the patient may kill the patient. There are many numbers that will be publicized for ambulance services. Please call us. And from hospital to hospital, these ambulances will ensure that as we are transferring a patient, the patient is not stopped from receiving optimum care. I will do a symbolic handover to Dr. Ashaolu, who is MD of Asokoro General Hospital and the representative of all the MDs.
The Federal Capital Territory Administration has donated 12 ambulances to 14 hospitals in the FCT to boost emergency healthcare delivery for the residents. The FCT administration is actively engaged in enhancing its healthcare services across the territory. These include investments in infrastructure and the provisions of essential medical equipment. These donation of ambulances to the healthcare facilities in the territory, stakeholders believe, will help to meet the emergency healthcare delivery needs of the residents.
This administration has paid allowances that have been due, some even since 2021. I wish to particularly refer to the 13th month hazard allowance for healthcare workers and wage award, the medical residency training fund. I can confidently say that FCT is the only state that has paid all these allowances up to date. For this, we say thank you, sir. There have been many other interventions, including the upgrade of the School of Nursing to a full-fledged College of Nursing, making it the first College of Nursing also in this area of the country. All these interventions together, when we reflect on it, it shows a deliberate and coordinated effort to deliver accessible, high quality and responsible health care for the people of the FCT. On behalf of the health sector, we sincerely appreciate you, sir, Honorable Minister, for this support and commitment.
We commend the leadership of the FCT Minister in prioritizing emergency health care and strengthening the health system in the FCT. This official launch of this ambulance is a significant milestone in enhancing emergency medical service and improving health outcomes in the FCT. For us in WHO, we are committed to supporting the FCT administration in achieving its health goals, particularly in emergency preparedness and response. WHO works closely with the Health Service and Environmental Secretariat and all partners in the FCT to build resilient health system, promoting universal health coverage and ensuring that everyone has access to essential health services. These ambulances will undoubtedly save lives and reduce mobility by providing timely transportation to health facilities. WHO applauds the FCT Minister's efforts to strengthen its emergency medical services and looks forward to continued collaboration.
Health system involves a lot of things, and emergency is one very, very important aspect of management. Something needs to be done sometimes, and those things have to be done within seconds, else life will be lost. Sometimes it needs to be done within minutes. Not everything can wait for days. So speed is one very important aspect. And today we're here because our Honorable Minister has deemed it fit to provide these ambulances. And all of us know what these ambulances can do.
I want to sincerely appreciate the Minister of FCT on behalf of nurses in the FCT for providing these ambulances that we commissioned today for the services of humanity in the FCT. And particularly, let me also thank the Mandate Secretary who actually initiated and facilitated this giant and laudable project. Honestly, on behalf of the nurses, we say this commissioning of the program is coming at the right time when the Nigerian nurses just secured a hosting of Confederation Confederation of Commonwealth Conference for Nurses, which we are expecting about 68 countries to come to Abuja by April this year. And by the special grace of God, Abuja will be hosting these 68 countries. It is a privilege, and this is the first time Africa is hosting this program. For that, I want to appeal to the Honorable Minister. We are very grateful with what you have done in the infrastructure or road infrastructure, and we welcome you today to the health sector. And we have no doubt you are going to work very well in the health sector. We have some challenges, little challenges in the health sector that I pray that when you are coming in today in the health sector, we'll target on those things. One, we have gross shortage of manpower. We have some dilapidated infrastructure, shortage of equipment. We believe you are coming today will target all these things, and by the special grace of God, you will do better there than you did in the infrastructure.
Thank you so very much for this gesture. I wish to assure you that these vehicles will be well maintained and we'll look after them as a commitment to healthcare delivery in the Federal Capital Territory.
Handing over the ambulances, the FCT Minister Nyesom Wike announced plans for the rehabilitation of 14 healthcare centers.
This is the support for the FCT to support the emergency services as it relates to the health system. The Mandate Secretary has read out everything that we have done in terms of paying allowances that were there before we came. Nobody went to strike, even though those debts were being owed. But thank God, to the glory of God, that we'll be able to pay off all these debts. I did say before that every sector will be looked into. So many people were saying, why are we concentrating on road infrastructure? So many people were saying, why are we focusing on education? But people forget that these ambulances may break down when there are no good roads. When it is emergency period for you to convey patients and the roads are not motorable condition, then the whole essence of the emergency vehicles becomes useless. So first thing first, and that's what we have been able to do. As we speak here, we're already procuring process of rehabilitating and furnishing 14 of our health centers. The representative of the nurses has said problems. Let me just tell you this. Nobody can solve our problems. And people take this for granted that even if you give a president 40 years, life president, people like Museveni in Uganda, they can't solve our problems. As far as we are living, problems will come up. What's important that you are focused and you do the best you can do. When you leave office, another person will come and continue from where you stop. The representative of the resident doctors has said staffing. The chairman of service is there. We have given approval. Sorry, head of service, I didn't know. ESFCD. The head of service, I mean chairman, have been directed to employ personnel for the health services. And for us, we will do everything humanly possible to give our people the best. But let me also use this period to say that, and to workers, and to some of us who are management staff, who sabotage the efforts of government. I've said that the whole essence is to have dialogue where there are problems, is sit down and say these problems, I can solve this now, leave this for me tomorrow, I'll be able to solve that tomorrow. If you make a request or a demand of 5 items, for example, and the government said, okay, we can take up these 3 items. After this, we'll take up the other 2 items. If you're really sincere, if there's no objective behind it, there's no way you will not accept. Before this administration came, ask anybody here, all of them here who are permanent secretaries, they would have retired as directors. Nobody has been a permanent secretary since the inception of Federal Capital Territory Administration. Nobody. They've never had head of service before. They've never had their own civil service commission before. And an institution came and said, listen, you cannot retard people's growth. How will people attain the level of director? And then he said they have no hope to be permanent secretaries or even the head of service. I challenge anybody. And I tell people, how much does FCT get? FCT gets 1% of the allocation to federal government. So if federal government gets 1 trillion in a month, what FCT will get is 1%. And what is 1% of 1 trillion? It's 10 billion naira. What is the salary today? Not less than 12 billion. Now in that case, you have to make sure you improve your IGL to be able to supplement and pay salaries. And then see what you can do in terms of infrastructure. Nobody can just bring out the whole money and pay allowances and wages. How will we buy these vehicles? How will we construct the roads? how we rehabilitate the schools. And this were in TSA, and it was difficult for us to access funds. What was happening was just approvals, buying of computers, the whole money will finish. And yet you say, when this minister was there, he couldn't do anything. How would he do something? He would go and print money. When I came, this FCT idea was 9 billion naira. 9 billion a month. Today, by the grace of God, we have hit not less than 30 billion naira every month. And what is called performance? What is called performance? So if we have 30 billion, and then we remove 2 billion naira to augment for salary, and then it's okay, remove another 12 billion naira for infrastructure, and then the remaining one you have to run the thing. The moment you see 5 billion naira in the account, you remember that something that was not paid in 2015, it is now that they will pay it. That is not a way. That is not the way it's supposed to be. So I appeal to you that the future of this country is on all of us. Mr. President is doing the best he can do, but you can also support by being progressive-minded.
All the benefiting 14 hospitals have taken delivery of the ambulances, which will ensure residents have access to effective emergency and routine medical care.
With focus on strengthening the health system, particularly in the areas of data collection and reporting for effective planning and improved service delivery, the exercise followed all laid-down protocols aimed at ensuring transparency, accountability and fairness in the selection process of candidates for the National Health Fellows Program in Abuja. The Mandate Secretary, FCT Health Services and Environment Secretariat, Dr. Adedolapo Fashawe, reaffirmed that the fellows will play a key role in strengthening the health sector and called for increased human capacity training and a higher fellowship quota for the FCT.
We insisted that all the people that will support our health systems here may be residents of here, so that they know the terrain, they know the language, they know the health-seeking behavior. And because of that, we've also had good success, because the people in that environment are able to relate with this young health fellow that they had never heard about, and they don't know their roles.
Key stakeholders at the screening included the World Health Organization State Coordinator, Dr. Kumshida Yakubu Balami, Director of Public Health, Dr. Dan Gazama, SWAP Officer, Dr. Teresa Machuku, amongst other health sector partners.
What I love about the selection process of the National Health Fellows is how transparent and how seamless it is. Because in Nigeria, people think that you cannot achieve anything without having a godfather. For the National Health Fellows, there's nothing like that.
The initiative is part of the National Health Fellows Program aimed at recruiting young professionals across all 774 local government areas in Nigeria. From this process, 8 candidates will be selected to serve in the FCT.
Residents of the Federal Capital Territory are hereby alerted to the activities of scavengers, also known as Babambula, which security agencies have identified as a high-level security threat to not only the residents but also to our infrastructure, as they perpetrate petty stealing and acts of vandalism on public utilities. More so, they are drug peddlers, serve as spies to terrorist elements, and are ready-made tools for the public disturbances, during which they attack people with dangerous weapons. The Federal Capital Territory Administration therefore therefore reiterates that the ban on scavengers aka Babambula operating within the Federal Capital City is still in force. These miscreants are advised to stay off the streets of the Federal Capital City for their own good, as defaulters will be apprehended and prosecuted, including parents of underage children involved in these practices. Relevant agencies are carrying out enforcement of this ban as stipulated. Be law-abiding always. Let's together build the FCT of our dreams. Management Announcer.
This is where we call it a day on the program this week. Keep a date with us next week, same time, same station. Be vigilant and report suspicious activities around you. Goodbye.
Citizens of the Federal Capital Territory, take note. On Saturday, February 21st, 2026, we will go to the polls to elect 6 area council chairmen and 62 councillors. Voting starts at 8:30 a.m. in all polling units across Amak, Abaji, Buari, Gwagalada, Kuje, and Kwali. Remember, no PVC, no voting. Check your registration status now and know your polling unit. This is our city. Let's get the facts right. Abuja Decides 2026. This message is brought to you by the Independent National Electoral Commission, INEC. Making your vote count, consolidating our democracy.
Download On Fct app and enjoy the variety of sports anytime, anywhere. On Fct app, at the heart of the game.